I'm very excited for the launch of the ARC Hub for HealthTech. It's a partnership between the University of Galway, ATU and RCSI. It's a major injection of funding to help us bring the technologies we're already developing in the ecosystem to patient impact. The ARC stands for Accelerated Research Commercialization, and then HealthTech means technologies that are going to have impact in health delivery in the future. The overall program's aim then is to accelerate how we develop technologies, provide the correct support to those people who are developing the technologies, and make sure they make it all the way to patient impact.
What we're aiming to do with the ARC Hub is identify clinical projects that have the potential to address a true unmet clinical need for our patient population, and then support these projects through the translational pipeline to commercialization and ultimately to clinical adoption so they can transform healthcare for our patients.
So we are designing a medical implant for women with ovarian cancer that will be delivered at your initial surgery. It can be used to treat for the initial treatment regimen, and it will be left in there, and we can access it then later. So our device can be used to deliver chemo, but it can also be used for some of the newer treatments for cancer, such as immunotherapy and cell immunotherapy in particular. We're trying to deliver it locally, targeted. For ovarian cancer or other cancers of the abdomen, local delivery has been shown to have a beneficial effect.
Our project is ICU Safe Notes. We generally collect a lot of data on patients. They're often on an awful lot of different medical devices, from ventilators to dialysis machines, and a lot of physiological data is collected. We also write a lot about our patients, so we'd write notes, either nursing notes, physio, doctor's notes, and this contextualises a lot of the data. So what we plan to do is to try and merge both the physiological data with the unstructured clinical data so that we can improve our prediction tools, improve how we aid our clinicians to make decisions.
I think we're at a really important time right now for understanding the impacts of artificial intelligence and making sense of all of the vast amounts of data that are available from health information systems, particularly in, for example, intensive care units. There's a huge opportunity to try and gain insights for patients, gain insights for the future.
I'm leading a project to develop a new device for real-time personalised treatment of high blood pressure. So what we're trying to do in this project is look at a drug delivery device that can give real-time dosing of medicines for patients. So this will take pressure off the healthcare system because it means that clinicians can remotely monitor patients' blood pressure. It also means for the patient that their blood pressure stays within a healthy range, which means they're less likely to have adverse outcomes or have to be hospitalised, which is really good for the patient. So it will essentially be able to sense changes in blood pressure and decide whether or not somebody needs a dose of their blood pressure medicines, or whether over a number of days that dose needs to be increased or decreased to keep their blood pressure within a healthy level.
I'm working on a project that is looking to improve the lifespan of insulin drug delivery devices for people with type 1 diabetes. So we're going to hopefully expand it from its current working function time from 2 to 3 days and expand that hopefully to 7 or even 10 days, so that if a person with type 1 diabetes is using one of these devices, they won't have to change it as frequently as they currently have to.
So this ARC project is what's called Uri-Care. So Uri-Care is about caring for the urinary system. 30 to 40% of women suffer from what's called recurrent UTIs. And a recurrent UTI is when someone has a UTI more than 2 times in a 6-month period. And current therapies are basically antibiotics. So you go to your GP, it gets diagnosed, the GP gives you antibiotics. The antibiotics clear up the infection, but then it comes back very quickly. So what the Uri-Care project is about is trying to prevent the reoccurrence. There's no real drugs involved here, so we're using a principle called electroporation. So if you actually treat cell membranes with electricity at the right strength and frequency, you can actually create little pores. And these pores are what we hope that will actually allow us to kill resident bacteria that have actually evaded the chemical that is the antibiotic. So there aren't any antibiotics here, it's a different approach. So the antibiotic is what treats the active infection, whereas our electroporation therapy is going to try and kill those bacteria that have evaded antibiotic.
So the vision for the ARC Hub for HealthTech is that we remove those silos of individual people working on individual projects. We bring everybody together with the ultimate goal of kind of expediting the process and getting solutions to the clinic as soon as we can, which ultimately benefits the patients in the end.